Salam everyone. My name is Omar Ammari, and today I'm joined by a very special guest, Zeinab Raishouni. Zainab is a licensed psychotherapist based in Michigan who specializes in a multitude of disorders, including anxiety, depression, multicultural issues, and a plethora of other subjects. Zainab, thank you for joining us today.
Thank you so much for having me. It's a pleasure to be with you here today. And I look forward to this conversation we're going to have. Hopefully it's a fruitful one.
No, I'm sure it will be. Yeah, no, I'm very
Inshallah,
excited for
hopefully.
this. So to start off, I just wanted to get to know about you. I wanted to give you the opportunity to share more about yourself, including why you decided to become a psychotherapist and what your journey has been like leading up to this point.
Yeah, of course, absolutely. So I was born and raised here in Dearborn, Michigan, in the United States to immigrants. My parents came to the US about 45 to 50 years ago. My mom's been here for 50 years. Dad has been here for 45 years. So a really, really long time. Um, I I'm a quadruplet. That's a fun fact. I always tell people that I'm a quadruplet because I think that really sticks and people hopefully won't forget me because of that fact.
That is
So I
very interesting.
Thank you. Thank you. And I have twin brothers as well. I am a licensed psychotherapist here in the state of Michigan, have been for about going on 6 years now. Been in the mental health field for 7 years. I studied at University of Michigan, Dearborn for undergrad. Um, and I went to Wayne State University for grad school. I have an undergrad degree in psychology and a master's in clinical mental health counseling. And I started my clinical work at Access in Dearborn. I don't know if you've heard of Access. It's the biggest Arab nonprofit organization in the United States. I worked in their general mental health department, and then I ventured into the Victims of Crime program, which is, I believe, called Survivors of it's called the SOV program, Survivors of Violence program now. I was a therapist in that program. I worked with, a diverse population impacted by domestic violence. And then I left Access, which was a great experience overall, and went into private practice, and I've been there since. Um, in terms of a little bit about my personal experiences and kind of what brought me into the mental health field. Uh, Hold on, was that the next question, or
That
am I
was that was
ahead?
no, that was a part of it. I was, if you're comfortable sharing, I would love to hear what got you into that field because I feel like a lot of people have something that they've gone through that causes them to pursue something like psychiatric services or counseling or mental health treatment.
Hey, I think you're absolutely right. I think many people end up in this field not by accident or coincidence. I think there has to be some sort of passion for this type of work. And I guess going into the mental health field was a very personal decision. I lost my brother when I was 9 years old, and it changed my life completely. Looking back as a kid, I'm like, yeah, life seems different, but I couldn't quite really grasp what the changes were outside of just losing my brother.
Hmm.
Uh, but looking back, obviously, it affected my family dynamics, the way my mom showed up for us, God bless her, she did the best that she could, in addition to like the rest of my family. But I think it was that adversity, losing my brother in childhood. I was obviously a grieving child, a teenager who, went through a lot because of the loss and grief I was dealing with, right, over the spectrum of my childhood. Um, and then I went to college and I took a few psychology courses and it started to all make sense. I'm like, oh, okay, this is why I was an anxious kid, or this is why I was struggling when I was a teenager and I felt depressed at times, or, it all started to make sense. So my interest grew. when I was an undergrad, and then I'm like, yes, I found my calling. And with the grace of God, I was able to become who I needed the most. So I mean, long story short, that's how I ended up in the mental health field, definitely due to my own experiences, growing up, absolutely.
Yeah, no, that's very tragic, and I'm sorry to hear that happened to you, but it's very interesting how you turned like such a negative and like honestly very sad experience into something valuable. Like now you are helping other people that may be going through something that your younger self went through. And
Yeah.
you took all the strength and courage that you built up over time to help these people in return. And I think that's a beautiful thing.
Thank you. Thank you. Alhamdulillah, and I think you get to a point where I think to continue your healing, you have to kind of this was my motto actually, kind of take pain and turn it into purpose. And that's what got me through my adolescent years. That's what got me through, honestly, my adult life so far, is turning that pain into purpose. And I think it kind of comes down to resilience, right? I think somehow we're able to cultivate that resilience. And of course, like I didn't do it all alone. Like I had God and then my support system and family. So I was able to, alhamdulillah, work through all of that and give back. So yeah,
That's awesome. I love that motto too, to turn pain into like something more, turn it into what did you say specifically? You said turn
pain
pain
into
into
purpose.
purpose. I
Yeah.
love that motto. That's
Yeah.
awesome.
Yeah, thank you. I
So,
live by that. Like it's constantly in my
yeah,
head. Like whenever I go through something tough, I'm like, all right, Zainab, pain into purpose, pain into purpose.
yeah. No, that's awesome. And I think that everyone can live by that in some way, shape, or form, even if it's not something as tragic. I think that motto can apply to a lot of people's lives. So
Yeah.
that's awesome.
Yeah, thank you. And by all means, I mean, I think it's important to feel our pain. I think it's important to sit with it long enough to understand it, in order to turn it into purpose. So it's not
Yeah,
like, oh, pain into purpose, and then it's like an impulsive, healing process. It definitely takes time, it takes patience, to be able to kind of understand what you're feeling and work through those feelings and be able to kind of do something and reprocess and reprocess in order to do something with those feelings, definitely.
awesome. So just to follow up on that previous question, now that you've been a psychotherapist for, as you said, 6 years coming up on now, right?
Yeah.
How has your cultural background, your ethnicity, your religion, how has that experience influenced your approach to therapy and helping others?
I'm sorry, do you mind just repeating the question? I'm
Yeah,
sorry.
how has your cultural background and experience influenced your approach to therapy to helping others? Like, do you use your culture, your understanding of your Arab culture? Do you use your understanding of your religion to help other people that may have similar backgrounds or similar experiences to you?
Yeah, absolutely. So, I mean, I'm a clinician who works in Dearborn. So and although I service a diverse population, I don't only service Arab, but I would say, considering the geographical location of where I'm at, a big amount of my clients is Arab American, young adults or older adults who do come to see me. And a big part of why they end up, let's say, choosing me or any of my colleagues who are also Arab is, because they really are in need of culturally competent care. So I would say I definitely take many aspects of our culture and utilize it when I am working with my clients. And of course, I meet them where they're at. I take a look at what parts of the culture do my clients value, right? So I don't say cultural competency is like a one size fits all. Um, so I like to tailor my approach to the clients I'm specifically working with, because even amongst the Arab culture, right? what Arab is not like what it's an umbrella term, but then we have Lebanese,
Yeah.
we have Jordanian, we have Palestinian, we have Syrian, we have, people from different areas in the Middle East that fall under this umbrella of Arab, and each culture under this umbrella has its own values, traditions, and whatnot. I would say overall, though, we come from a collectivistic background. So in terms of I definitely keep this collectivistic mindset in mind. Because as we work in the United States and we're immersed in a Western society, um, the culture here is highly individualistic. And oftentimes there's an identity crisis people do experience because of the sense of individualism here and trying to maintain family ties and then being reared in a collectivistic household. Oftentimes there's some sort of clash or identity crisis that people do go through. And I think it's important to take into account cultural sensitivity, an individual's values to kind of treat them from like a holistic um, perspective.
No, I love how you brought up cultural competence, especially in a professional setting. I think a lot of people can benefit from exp like people that are outside of our culture, like doctors, therapists, can benefit from learning more about different cultures, whether it's the Arab culture, whether it's learning about other cultures, and they can more effectively treat their patients, more effectively communicate with their patients, and there's can be a like less misunderstandings because I feel like a lot of times there are misunderstandings or there's like a wall to getting help in the professional medical world because of people not having because people have very diverse backgrounds, especially in the Arab community. We're all very diverse. So as someone who is Arab, I think it's awesome that you can use that background that you have to serve the Arab community as well as other, diverse communities. So I
Yeah,
appreciate you bringing that up.
yeah, for sure. And then, in terms of just cultural competence, I think it's important to understand a client's lived experiences, right? And our lived experiences aren't right here, right now. Oftentimes, they have to do with what happened then and there, what happened throughout our childhood, the environment we have, right? Because a big part of mental health issues or mental illness, I mean, it's genetic and environmental. So, our
Yeah.
environment, where we come from in the world, has a lot to do with how we experience the world and how we interact with it and the prevalence of, specific disorders. And then we can't even dismiss generational trauma. And I think this is where, also cultural competence does help because I mean, we come from adversity. In the Middle East, unfortunately, and impoverished areas, right? I mean, we've been through wars throughout, hundreds of years. So I think we can't dismiss these lived experiences as we work with, individuals.
Yeah. No, I 100% agree with you. Especially with our background, especially with the violence that a lot of people grow up with in the Middle East, having to relocate to the US. I think it's important to take individual experiences, especially if you're coming from like those war-torn areas. It's
Mhm.
important to take those into consideration when you're dealing with people. So that's
Yeah.
awesome. I appreciate it's always good to hear other people, like especially professionals, people that are helping others are aware of that and aware of how important it is. So I'm very happy to hear that. And going off of what you said, so you do practice in Dearborn, Michigan, which you said is like a hot spot for Arab Americans. What are some common mental health issues you see in the Arab American community that you serve? Like, what are some more common issues?
That's a great question. Now, when I worked at Access, um, I was working in the general mental health department. Obviously, when you go to a place like Access in the general mental health department, you're working with individuals who have serious mental illness, right? So they qualify to receive services in that space because of their their diagnosis and they require a higher level of care. So there were psychiatrists, case managers, therapists all working in one spot. So they were offering wraparound services. And what I saw there um, was lots of schizophrenia, bipolar, major depressive disorder. And oftentimes, these individuals were living in impoverished areas. They were refugees coming from the Middle East. Many of them were immigrants. But I would say, I mean, mental health disorders don't discriminate. So they affect us all similarly, but differently. I would say now in private practice, I see lots of depression, lots of anxiety, adjustment disorder in the population that I service and trauma, to be honest.
Adjustment disorder, as in like acculturation stress, getting used to like being in the US, or
Not necessarily. I would say adjustment disorder due to like getting married, for example, switching,
I see.
moving a job, or like let's say big life transitions have taken
Yeah,
place. Sometimes breakups, right? Or like, things like that for the most part.
yeah, no, like you said, mental illness doesn't discriminate. It affects all of us equally because we're all humans at the end of the day. And it's interesting to hear that a lot of the mental health disorders that you described as more common or more frequent are probably some of the more common or frequent mental health disorders that you find in the US population. So I would think that the reasons for it may be different, especially like when you mention anxiety or depression, it could be due to like family stress or like things that are more particular to Otter. But I'm not asking you to violate HIPAA and speak about a certain patient. I was just like
Yeah,
curious of the specific like disorders that are prevalent. And that makes sense. It does make sense from my standpoint, from my own experiences. So thank you for sharing that with us.
of course. Of course. And that's why I said earlier it's similar but different. And you're right, in terms of the point you make, you're like, the general population may be going through, I mean, similar disorders, but definitely for different reasons. Not for different reasons, but different the presentation sometimes just looks a bit different, right?
No, 100%, 100%. So, as you know, mental health is heavily stigmatized within the Arab community. And as someone who is Arab, I'm sure you know about a lot of the stigmas around mental health, whether it be due to religion or whether it's just like the old-fashioned way of thinking. And one of the big things that our organization strives to do is to reduce the stigma around mental health. And I wanted to know from your perspective, from your experience, how do you think we can continue breaking down the stigma around mental health in our community? As our, like I'm saying specifically, like how can our organization do it, or how can anyone contribute to reducing the stigma around mental health?
I think it would have to be like a multifaceted approach. I think where we can start though, and where many communities have started, is having conversations like these, for example, right? Shedding light on mental health versus mental illness or like just mental disorders and what they look like, right? And also being honest with our own experiences because people sometimes and I get it, right? There's we come from a culture that likes to uphold honor, right? And we kind of stay away from shame. So people don't necessarily want to talk about their experiences openly and honestly. And hey, I get it, right? Our experiences are not to be shared with everybody, especially if that trust and safety and security is not there. So I totally understand. So I think so breaking the silence, right, and having these conversations is the first step. But in order to have these conversations and break the silence, right, that has been preserved due to shame or sometimes isolation or how we kind of show up in the spaces where, let's say, if, for example, let's say, I mean, if like people are labeled, right?
Yes.
Unfortunately, right? They're called
Hmm.
crazy, or they're called like in Arabic majnoon, right? So I think
Yeah.
changing
Yes.
language, I think is a step. But then circling back to something I was saying earlier, and I kind of went off
Yeah.
on a tangent, where in order to break the silence, we have to create safety and security. We have to create safe spaces. We need to judge less. We need to be more open. We need to give people benefit of the doubt. We need to be more kind, more gentle. We need to practice active listening. I think we have to create safe spaces within our communities in order to break the silence. Because if we're not creating safety and security for individuals to even have these conversations, then we're just reinforcing the silence, unfortunately, and then just perpetuating the struggle that people face as they remain silent.
No, you explained that so beautifully. Just to like kind of go over, like you said, open conversations. I 100% agree with you. That's one of the reasons why we do these interviews is to have these open conversations with people. Obviously, you're more open-minded, but the goal is to have people watch this and see that it's okay to open up about mental health and that there are people out there, other people like them that are struggling with things. And it's okay to have, struggles. It's also okay to know that there's treatment options out there and to know like the differences between different mental health disorders or mental health illnesses. So a big thing you mentioned was also education. So educating people on those things. What I feel like one of the best ways to reduce stigma is through education because a lot of stigma propagates online through misinformation. So I think educating people is also an amazing way. And a lot of the things you mentioned, which were like barriers to um educating people or barriers to having people open up, like isolation or being labeled like a Majnun, as you said, those are very relevant. When you were mentioning them, I just resonated and I thought about my own life and my own experiences and how relevant everything you were saying was. And I know that I'm not the only one. So I 100% agree with everything you had to say. And it's gonna take some time. I think it's not something that happens overnight, obviously.
Definitely.
And especially for like people who have been very stuck in their ways for a long time or have believed one thing for a long time, it's more difficult to get them to think in a different way. But like you said, we have to be open-minded to newer things if we want to progress and make, progress.
Yeah,
Yeah.
absolutely. And in terms of like, I mean, just like we have physical health, we have mental health. We have a brain we got to take care of, right? So sometimes just because we're going to therapy, let's say, or we're seeing a counselor or we're seeing a psychologist, um, like I get for like insurance purposes, we're making a diagnosis, right? But it
Yeah.
doesn't mean someone has to have a severe disorder, right? I mean, like I said, I see a lot of adjustment disorder in private practice, and going through life transitions is tough. So your mental health sometimes takes a toll. Life gets tough, right? It gets heavy. So you don't have to go through that alone, right? And sometimes people fear treatment because they think like they're going to be labeled, right? And even as a clinician, I don't love the DSM. I don't know, maybe people disagree with me, but I don't love it for so many different reasons, right? I don't think it takes into account poverty. It doesn't take into account culture or lived experiences. Um, so I don't love it for that reason. And personally, as a clinician, I don't necessarily like to label my clients at all. Like we don't really even
Yes.
talk about diagnosis if we don't have to. And if we do, we're doing it for with the purpose to educate, right? And I think it's important for people to know that mental health, right, doesn't necessarily mean like let's say if you're struggling with your mental health, it doesn't necessarily mean you have a severe mental illness, right? So it's not wrong to kind of seek support when you're struggling, and take care of your mental health, which you pretty much have to on a very regular basis, just like you're taking care of your physical health.
Yeah. No, I 100% agree with you. So just to transition off the topic of like Arabs, I'm actually very curious in your profession, like what you do as a psychotherapist, because I think a lot of people are unfamiliar with psychotherapy and what are the differences from like, regular therapy. Like prior to like starting this whole thing, I wasn't really sure what a psychotherapist was or what they do. So if you don't mind, can you just share some of the differences and what differentiates your techniques and practice from other treatments like that a normal therapist would do?
I would say, to be honest, the term psychotherapist is used interchangeably with the term therapist. Now, just from like a general standpoint, when we think of just the medical field, therapy can encompass so many different types, right,
Hmm.
of different services, whether it's physical therapy, occupational therapy, speech therapy, different types of therapy. And then there's psychotherapy, right? Psychotherapy is typically offered by a highly trained individual in the mental health field. So you have social workers that offer psychotherapy, you have counselors that offer psychotherapy, you have psychologists, psychiatrists, and sometimes nurse practitioners that also offer psychotherapy. Now, psychotherapy specifically, right? What do psychotherapists do, right? Psychotherapists diagnose and treat mental illness. And then they set goals and they collaborate with their clients on setting goals that are appropriate, right? And they kind of work on developing a treatment plan. And psychotherapists utilize evidence-based interventions to be able to assist an individual with the specific disorder they are experiencing. So psychotherapy should be and has to be evidence-based, offered by someone who is licensed and, qualified and trained. Now, sometimes people come into therapy and they're not necessarily looking for that evidence-based. They come in, I'm sorry, they see a psychotherapist for therapy, and they're not necessarily looking for the psychotherapeutic interventions, right? So I ask
Yeah.
clients, like, all right, do you want to have a vent session? I mean, what exactly are you looking for here? Some clients are like, look, I want to be able to come in. I need your support. I need a safe space. I need to be able to talk about all these things. And that's what one client wants, right? And to be honest, I meet them right where they're at. If they don't really necessarily want to change things in their life, if they're not there in terms of readiness for change, I meet them right there. And then I have another client who comes in who's like, okay, I have, I'm experiencing these symptoms. I want to, work towards, this specific goal. Now help me get there, right? And that's where the evidence-based interventions come in. Now, as a psychotherapist, I like to use evidence-based interventions most of the time, right? Even when
Yeah.
client comes in for quote unquote a vet session, I'm using person-centered psychotherapy, right? Which is very Rogerian. There's a lot of unconditional positive regard, a lot of empathy, right? It's very client-led and non-directive on my end. And we're still working towards an overarching goal, right? That the client has set. And then sometimes in psychotherapy, goals are very specific. So I guess it's not necessarily a one size fits all. And I'm sorry, I don't think I answered the entire question, did I? I think there may be parts I had left out.
I was just asking for like the differences between or like what differentiates your techniques or practice. Um, I feel like you answered it for the most part. I
Yeah,
don't think
and
you left anything in.
So there's different, also one thing I wanted to highlight
Yeah,
is in terms of therapy, right? There are there are individual services, right? You can see a therapist for individual therapy, then there's like marriage and family therapists, and then
yes.
so each type of therapy has like a professional that's pretty much highly skilled, highly trained in that one area.
Yeah.
So that's another thing that also kind of just stands out. Let's say um, if you're, I mean, a couples therapist can offer individual therapy, right? It just really depends. But I think, let's say it's important to kind of seek out someone who will be able to assist you with the specific symptoms and, experiences that you may be, struggling with. So I think that's pretty important also for people to kind of look out for when they are shopping for a therapist, to shop carefully.
No, you're 100% right. There are therapists that specialize in specific, disorders. When I was looking into you, I saw that you had like such a like a vast um like a very broad spectrum of issues that you kind of work with.
Yeah,
So, but then there's also, like you said, there's people that specifically specialize in one thing, like marriage counseling or pediatrics or like something around those lines.
yeah,
So it isn't important when you're looking for a therapist. Even for me, when I was looking for a therapist, it was hard to find one that specifically like dealt with the issues that I was facing. And
yeah,
you could have a lot of people could have a bad experience if they don't find the right therapist that fits their
yeah,
issue.
yeah.
And that could scare people away from therapy. So
Absolutely.
I highly encourage people to be very, not picky, be very mindful that not every therapist is going to know how to deal with your specific issue and to look for one, like you said, that meets that criteria and specializes in what you would like.
Yeah, and I tell my clients, hey, I'm not for everybody. And by all means, if you don't think we're a good fit for one another, then let me know. Like I'd be happy to offer a referral, right, to someone else who may be a better fit.
No, that's awesome that you don't like just trap them within. You offer other like
Yeah.
options, other solutions. That's awesome. To transition, violence in Arab countries has been going on for decades with like recent peaks due to events in like Palestine and Syria. A lot of people are forced to relocate to other countries, including the US, and a lot of Arab Americans in the US still have family members located in those hot spots of violence in the Middle East. So, how do you see these events impacting Arabs in the United States, even though we are thousands of miles away? How do you see all this violence and terror happening, like on the other side of the ocean? How do you see like those events that people are watching on like Facebook and social media affecting them here?
So, to be quite honest, I mean, although we are 1,000 miles away, I think many people can probably relate to the notion that when we're sitting behind our phone screen, we feel as if we're there. I mean, we're not, and I can't imagine, right, the horror that these individuals are experiencing there. But I think any person with a heart, right, with a conscience, um, would feel grief,
Yeah,
right? Would feel anger, right? And would empathize with what's happening in Palestine, or Lebanon, for example, or other war-torn countries in the Middle East. So how are we impacted by it, although we are 1,000 miles away? So, like I said, anybody with a heart who has empathy is likely going to be impacted by it. Now, just because, I mean, if I mean, some individuals dissociate, they disconnect with what's happening because it's too much, it's too overwhelming, right? I get that. But how is this affecting us, right? I think we see people go through, or I specifically see in terms of like my line of work, because I have clients who, come from these parts of the world, right? And they have families that are living these experiences, right? And these atrocities that are taking place, or they've lost loved ones, right? And I think there's definitely lots of grief. There's lots of grief around what's happening, whether they're going through the 5 stages of grief in a linear fashion, or they kind of go from, I think what we saw initially when these atrocities first happened was just lots of shock, right? People were really utterly devastated. People didn't know how to, live their day-to-day life, almost as if life stopped for some time for some individuals, right? I'd hear often like, I don't know how to focus at work. And I'm one of those people, right? As I tried to like, provide the space for my clients, I was also struggling myself, right? And that's where I'm like, okay, every therapist needs a therapist to be able to unpack, right, what's happening. But there was definitely lots of grief. And what started off as shock, right, has turned into anger, right? We see lots of anger around what's happening, right? And I think this anger is righteous anger, right? Like, it's not the bad type of anger, right? Anger can be very positive. Like, righteous anger can look very much like, I can't believe this is happening to these individuals. And anger can be like a motivational state as well, right? It's that anger that pushes us to create change, to advocate more, to try to influence policy, to kind of put together these protests that we're seeing. So I think there's definitely lots of anger. People are very impacted, although we are 1,000 miles away, right? There's definitely anger because we feel for our people, we have empathy towards their experiences, and we want change, right? We want peace for Palestinians.
No, I heard someone describe it as watching it like on social media is like it's like as if you were there going through it yourself. And I can't even imagine what they're going through, but I
Yeah.
feel like I can resonate with that. Just like a lot of times I'll stay away from social media completely, just because it's too much to watch. And it very much affects people over here in the United States. And I think that what you mentioned, how people are going from grief to anger. I think it's the lack of action by, like, more powerful sources like the United States, the lack of justice that's happening, the continuation of all like the violence.
Yeah.
A lot of people just want their voices to be heard. That's why a lot of people are, going in the streets and they're having like these protests, these peaceful protests, and yet still they're being suppressed. Still their voices are not really being heard. And it's just making the situation worse. It's just
Yeah.
building it up over time. So I'm glad that you mentioned that too, because a lot of people, like I've heard people that are non-Arab say that they're fed up with the protests or they don't understand the purpose of it. But the purpose of it is to raise awareness and to just, I think, vent frustration.
Yeah, and I think it's our duty at the end of the day, as um, citizens of this universe, right, of this
Yeah.
planet, to advocate against injustice. I think it becomes our moral and ethical responsibility to be the voice for the voiceless, right? And I think as we try our best to do that, I don't think our best is even good enough, right? No matter what we do, no matter how much we advocate, no matter how many protests we organize, that's still not enough, right? Because
Mm.
um, we could always do more, we could always do better, in my opinion, right? And in terms of just circling back to something I think I forgot to mention, when we are sitting behind our screens, right, we're very privileged. We're sitting in the United States in the comfort of our own homes, alhamdulillah, we're safe, right? We have a warm home, we have food on our table. Um, we get to wake up and go to our jobs, we get to tuck our children in good night. Um, we're very privileged, right? And I think, though, as we witness the violence, right, through social media, there's definitely secondary stress or secondary trauma, if we want to call it, right? Because we have roots in these places, right? And these our people, right, that are going through these experiences. So it's hard not to carry, right, the pain of the violence that's happening back home. So oftentimes people will experience secondary distress, or if you'd say secondary trauma, due to what we are witnessing, right? So it's not uncommon, let's say, to have nightmares, to experience distress, to have a hard time focusing at work if you are watching the news, or if you are um, witnessing the violence through social media. People sometimes are affected this way, right? Where they do start to experience symptoms of the secondary stress, or secondary trauma.
Yeah. Well, that's beautifully put. 100%, I can resonate with that as someone who's, a citizen here watching the things. And I think a lot of people can also resonate with that. Um, a question I wanted to ask you. And it's a question that I've got into. I'm not a professional, obviously, but it's a question that I've also pondered myself is
Mhm.
a lot of olives avoid like going to therapy or like seeking out mental health treatment due to the stigma that perpetuates around it. Like you said, they're they fear being labeled or being like looked down upon as weak, or their religious relatives will say just pray it off. And while
Yeah.
I think prayer can be like a form of meditation, it's not going to help someone who's chronically depressed or like schizophrenic.
Yeah.
That I
And
think it needs to be partnered with,
yes.
proper treatment.
Yes, yes. Now, in terms of religion, I do think it's a protective factor, right? It can be very grounding for individuals, whether they're religious or spiritual, or maybe not at all, right? I mean,
Yeah.
now in terms of therapy, I don't necessarily I don't push religion on anybody. Of course I don't, or even integrate faith-based approaches if that's not what my clients are interested in. But like you said, I think faith can be very protective, but faith itself is not a um it's not treatment, right? So there has to be some sort of therapeutic evidence-based intervention there.
Yeah, no, 100% agreed. But that's just one thing that people will like say when like they avoid going to therapy. Oh, I have religion or whatever. So
Yeah.
the question I had for you was for someone who is like hesitant or like believes in these like barriers that exist around therapy or treat mental health treatment, um for someone who's hesitant about therapy, whether it's like due to the stigmas that we talked about or due to like a negative experience with therapy in the past, what advice would you give them?
Um, that's a very interesting question.
Yeah,
Now, what advice would I give them? I think, therapy's a great place to grow. It's a great place to heal. It should be a supportive space. Now, just because you have one bad experience with one therapist, unfortunately, it doesn't mean that you may not be successful with a different therapist. What I would recommend is, I think I said this earlier, shop around, right?
yeah,
Take them up on a free 15-minute consultation, right? Pick their brain, ask them questions, see if like you're a good fit for one another. See if you guys vibe, right? If you don't vibe, they're not for you. Don't make the appointment, right? Find somebody else. Like in a, you can browse through Psychology Today, take a look at different therapists' profiles, reach out to them. Now, if let's say someone is really opposed to therapy, right? Go to a support group, right? In my community, luckily, there's many.
mm,
We have support groups going on in like different spaces and places, right? So if you don't want to go to therapy and you're scared, because I get it, therapy can be scary. Like
yeah,
oftentimes, like I think my first therapy session, I was like shaking in my seat. I'm like, I don't know, what are they gonna ask me? How's this gonna go? What is this gonna be about? Like, what am
yeah,
I gonna
yeah,
discover about myself? It was scary. So I think meet yourself where you're at, educate yourself, read about, therapy, what you're going into, figure out what modality might be a good fit for you. Understand what your needs are so you can better communicate your needs to a therapist. If therapy is not your first go-to, join a support group. If a support group ain't for you, talk to a friend, right? Just make sure you're leaning on some sort of support system. Now, therapy is not as scary as people make it seem. So, for all of you guys listening, I really encourage therapy for everybody, right? You can come into therapy to, let's say you want to grow more as an individual, or you want to be able to work on, specific skills. I wouldn't say it's necessarily there for individuals who are severely struggling. I think therapy is a helpful place if you're experiencing mild, for example, anxiety, moderate anxiety, or severe anxiety. I think therapy can be very beneficial. And I would encourage people to think of it as just a safe space, right? Your therapist is not there to judge you. And if they are the wrong therapist for you, and that's not very ethical, right?
Yeah.
Think of it as a safe space, right? It's a space for you to be able to unpack your experiences, share your thoughts if you feel safe and secure. I think that's the foundation of good therapy, is that um, uh, the relational experience. And keep on shopping around until you find the right fit, and just give it a try. Give it a try.
No, 100%. I think it's interesting how you brought up introspection, people being afraid of looking internally, looking into themselves. That's one of the fears of going to therapy because I never personally thought about that, but that's a very valid point to make. And
Yeah,
I think it's awesome that you didn't like just say, "Oh, go try it out," especially if you've had a bad experience before. You kind of put like you kind of use like the foot in the door method where you take like small steps back into therapy, like going to a support group or like leaning on a friend or like a family member you can trust. I think that's really awesome. And like you said, everyone could use a therapist. Even therapists have their own therapists, a lot of them that I've spoken to. So I
yeah,
think therapy can benefit everyone.
yeah, absolutely. Um, I wanted to mention something, but I lost it. It'll come back to me, and if it does, I'll mention it. So sorry.
No, yeah, no, of course you could okay, you could just cut me off.
Okay. Thanks for giving me that permission.
No, no, of course.
I'll try not to.
No, no, it's okay if you do. So just to like final thoughts, this has been like a very valuable experience for me, getting to talk to you and learn more about what you do and the work that you do. Before we wrap up though, is there like any final message or any final advice you'd like to share with those who may be struggling but don't know where to start?
Um, wow, where do I start? What do I say? Um, I would say don't give up on yourself. Um, Meet yourself where you're at. Feel your feelings. Although accepting is hard, accepting where we're at. Um, Nothing is too big or too great to kind of heal from or to resolve. Um, there's help out there. Um, and there are people who care.
That's awesome. No, I think that's a beautiful message to share. I think a lot of people can benefit from hearing something like that because a lot of people may think that they just want to give up, or they don't think there's like sources or outlets for them, but there are.
Yeah.
So
And
thank
one thing,
you. Yeah.
it came back to me now, so
Okay.
I'm
Good.
just
Good.
gonna
I
chime in
actually.
there. So,
Okay.
um, in terms of therapy,
Yeah.
I think you asked me a question earlier, and this point came to my mind and kind of left very quickly. But let's say someone has a very bad experience in therapy, right? Um, I think it's important for people to remember that they have the right to. Um, they have a right to kind of dictate and decide how they want their treatment to go, right? And that's why I take a very non-directive approach, right? And I like to meet clients exactly where they're at. If they're not ready to, let's say, explore something specific, I respect that. We work on cultivating the safety, the security to be able to even process and kind of sit with heavy emotions. People have the right to kind of control what happens in their own therapy sessions. So I definitely want people to know that, right? If you show up to therapy and let's say it's not going in a specific direction or it's too much, too fast, too quick. And that's why sometimes people leave because they get so overwhelmed and they're scared, right? Rightfully so. They have a right to kind of slow things down, right? I tell clients, you're the expert on your own life. I'm the expert on mental health. So you're gonna have to like help me out here, right? Like we're working together. You're in the driver's seat. I'm in the passenger seat and you're telling me where to go. You're telling me what turns you want to make. You're telling me what you want to explore further. So I always let clients know like, hey, you're in control here, not me. So it's whatever you want to talk about. How and of course I keep therapeutic structure, but I do definitely want to encourage the client to kind of um, be there, kind of direct their own lives, right? I don't give them the answers. I kind of help them explore and kind of come to answers and conclusions on their own within the context of like what fits in their own life. Like I'm not living the client's life, right? I only know what they tell me within that span of like what 45 minutes to an hour. And they live with themselves. They know what it feels like to be in their own body, to have their own mind. So I tell them, you're the expert on you. I'm the expert on mental health and let's work together, right? So it's more so a collaboration.
Yeah, no, I don't think a lot of people know that they have a lot of power when they go to therapy. I think a lot of people are just under the impression that they have to trauma dump everything on their therapist or just like say everything, or they can't like keep things to themselves until they're more comfortable to open up. I like how you gave the analogy of like them being at the driver's seat and you being in the passenger seat. My initial analogy was like the captain of the ship where they're steering it and you're just like
Yeah.
on the side watching them. But
Yeah.
no, I think that's a
Yeah.
great thing for people to know when they're pursuing therapy. They don't really need to just let everything out at once. They can take their time and it's really them that they have the control to get the help that they need, and the therapist is there just to guide them on their own life.
Yeah. Yeah. Absolutely.
Well, thank you, Zainab, for sharing your insights and expertise with us today. Your work is truly amazing and making a difference in the community. I just wanted to ask, where can people find you if they are seeking treatment? Is it like a specific?
So people can find me on
Yeah.
Psychology Today. I do have a profile there, and you'll be able to kind of read my just a small little biography I wrote about, my approach to treatment. I am an EMDR trained clinician. I specialize in treating anxiety, PTSD, and trauma and relationship issues from an individual perspective. You'll be able to read more about like how I use different interventions, the way I kind of practice, and just some more general information. So you'll be able to find me on Psychology Today. I have an Instagram profile. You can find me there, reach out to me, message me. Yeah, so I would say the main space you can kind of reach out to me though is on Psychology Today.
Awesome. Well, thank you so much for your time. Take care, Zainab, and it has been a pleasure.
Of course, absolutely. Thank you so much for your time, and I appreciate this conversation we had. And I look forward to future collaborations or, having more discussions like this. So thank you very much again.